right, doctor, let's talk about hip arthroscopy, which is the surgery that we were talking about earlier with a camera. What exactly is it and how does it work?
Yeah, so hip arthroscopy is a minimally invasive way of getting into the joint. So we use small incisions, we put our camera in, we can see the entire inside of the joint. And then through other holes that we perform, or other incisions that are also small, we can introduce our instrument to perform the work that is needed. It's advancing technology, and it's a great technology, and we have good surgical techniques that we can solve a lot of issues inside the hip joint.
Doctor, is this something for someone that is suffering from arthritis, or let's just say certain types of injuries?
Yeah, so it's very good, great question, because the patients treated with hip arthroscopy actually have no arthritis at all. These are patients with no arthritis, that they have an injury, but they have pain, they have limitation, and they have poor function of the hip joint that is limiting and affecting their life. But it's usually related to a bone structure problem that is creating some contact and creating damage inside the hip joint. But it's before you have arthritis that we try to solve these issues.
And when does someone, doctor, know that they need this? Is it the pain that they're enduring? Is it a discomfort? Is it something over time?
Correct. So it's pain and limitations of function. They're not able to perform their daily activity. They have a pain that limits them performing. However, you go to get an x-ray and the x-ray shows no arthritis, but there is an issue there that we have to figure out what it is. And it's usually something in the soft tissue that you don't see on the x-ray, but it's easily fixable. A lot of the time we can treat it with physical therapy. If we know what is the problem, we can address and give you a physical therapy protocol to address that issue. And if sometimes you get better and you avoid the surgery, a lot of the time we can do it with just conservative management. But when you fail conservative management is when we have this other option where we can fix it with surgery.
May I ask you how this is different from traditional hip replacement surgery?
Yeah, definitely. So traditional hip replacement surgery is more a salvage procedure. It's something that you do when the joint is already destroyed, when you have a lot of arthritis, end-stage arthritis, then you do a hip replacement. Hip arthroscopy and hip preservation surgery is to prevent you from getting there. It's when you don't have arthritis, we identify some bony morphology that is creating an issue in your hip, and we can fix that problem. We can fix that morphology in order to give you a hip that is painless, that is fully functional, and with the hope of preventing you from having arthritis. So it's a surgery done in an earlier age to try to keep your own structure. When you do a hip replacement, we're changing everything for metal and plastic. But this surgery, we're actually preserving your structure, preserving your joint, but we're gonna give it a painless, functional joint. And we can do that sometime with the surgery.
Wow, that's fantastic, doctor. I have never heard of this. Is this outpatient? And tell me about recovery for the patient as well. I'm fascinated with this one.
No, this is a very good surgery. And yes, they go home the same day. You know, these patients, they go home the same day, and we start with physical therapy the day after. So it's a very active recovery. The next day after surgery, you're on a stationary bike. We send you with a machine that starts moving your hip joint to prevent scar tissue. And then every day we're doing some type of therapy, and it's a very active recovery. But yeah, you go home the same day and the pain is not that bad. I actually put some pain medication on the side, and the first day after surgery, you're pretty comfortable. And you don't need long-term narcotics, usually 1 or 2 days as a maximum. So the recovery is pretty good.
I have a video question here from Michael, and he apparently has a question on arthritis. Let's roll it.
Hello, doctor. Maybe you can help me out. I usually exercise a lot, and most recently my right knee and the inside of my left knee has been hurting a lot, right? And then I've also noticed my left ankle is really sort of sticking, especially when I get out of bed. I have to work it a lot up and down. And then my right wrist hurts. It sounds like it is arthritis. I really need to know what I should do so I can get back to my exercise routine. Thank you, Doc. I look forward to hearing your answer.
Oh, let's help Michael out.
Yeah, sorry to hear that, Michael. Yes, something that in your case makes me think quickly, when you have pain in different joints, we have to look into a systemic inflammatory disease. So that's inflammation that is running on your system. What it gives you pain is inflammation. So if you can control that inflammation, you're gonna feel better. So I think for the different joints that you mentioned, the idea will be to decrease that inflammation with anti-inflammatory techniques. I love ice therapy. Ice therapy is extremely helpful. It decreases your inflammation, doesn't have a cost, and doesn't have side effects. So those are always my first line of treatment. Then you can go into anti-inflammatory medication, but you have to be a little careful because those anti-inflammatory medications long-term can affect other parts of your body. So we have to be smart on that. And the key important part in all this, once you control the pain, it's important that you get muscle strength, that you do physical therapy and you get all the muscle mass around that joint strong. Because the stronger you are with the muscle mass, that will protect your joint and your bony and your arthritic area if you have arthritis. The stronger you are, it will protect you and it will prevent you from having recurrent in pain. Sometimes you can have some injections at that site to decrease the inflammation, but the concept is that decrease the inflammation and get strong. That will prevent you and will give you more function.
Let's take this one from Sophia. Let's show you the question. Actually, it's a video question. Let's roll it.
Hi, my name is Sophia, and I would like to ask about any natural supplement that you can use for joints and ligaments while you do sports.
Oh, I love that question. Doctor?
Yeah, good question. Yeah. So I think, going back to what I mentioned before, important is to have a complete full diet that covers, a good nutrition. There is some supplements that they sell, the glucosamine and the chondroitin. They actually are anti-inflammatories. They are natural anti-inflammatories. It's not that they're like building your cartilage back, but they give you relief of symptoms because they're an anti-inflammatory. And the good thing, they don't have too much side effects. But the more important thing is to have a complete diet and keep active. And like we said before, prevention, stretching and making sure that you keep your muscle very active and strong. And that will prevent you from having injuries more than any supplement or something that you can intake.
Even I took notes there. All right, doctor, let's take a question. And this one is from Rosemary. It's an email question, so let's read it real quick. I want to know if there is any cure for ataxia. This is when your gait or walk is very wobbly and unsteady. How can you steady your walk? Are there any medications for it? Thank you, Rosemary. Doctor?
Hi, Rosemary. Sorry to hear that you're suffering from ataxia. The important part on this issue is to diagnose what is creating your ataxia. Where is the etiology? Why are you having that? Because when you know the why, then you can treat it. There is no clear medication to take out the ataxia, but there is medication that can control the cause of you having that ataxia. But as a main concept is to keep your body and your muscles strong. So physical therapy, gait training, making sure that the muscle group that you need to walk and to keep stability are strong. Usually that's the problem. People become weaker and weaker and they lost balance and become more difficult to overcome that.